Smith County. Generations of East Texans have called this home. It's an ideal place to live, to raise a family, a community where faith is strong, higher education is expanding, and healthcare systems thrive. But there's another story that's part of the seemingly idyllic setting. According to the U.S. government, right now in Smith County, more than 35,500 people are living in poverty, including over 13,000 children. That's 1 in 6 adults and 1 in 4 children. These are people we know, people who prepare and serve our meals at local restaurants, who care for our family members in childcare centers, hospitals, and nursing homes, and who greet us with smiles in local businesses. These numbers raise serious questions. Thanks to the East Texas Human Needs Network, or ETHNN, we know more than ever before. First, what exactly is poverty? According to the U.S. government, a family of 4 is living in poverty if they are making less than $24,300 a year. However, in Smith County, in order to make ends meet, that family would need $43,000 a year. So, families making between $24,301 and $43,000 a year are struggling but not eligible for poverty assistance programs. Second, who exactly is in poverty? What are their circumstances? What are their needs? ETHNN members agreed to go to the experts, individuals and families living in poverty. And we agreed that we needed data in 5 aspects of life: education, employment, healthcare, housing, and transportation. ETHNN members interviewed 269 households that account for 528 adults and 185 children, each struggling to reach a level path. To simplify the rest of their stories, let's look at percentages. This is Bill. Bill dropped out of school at 15 in order to support his family when his single mom was diagnosed with cancer. Bill is married and has 2 children. Just like Bill, 22% of those we interviewed had not finished high school. He is working, but all he can get are part-time, minimum wage jobs, and right now he has 3 jobs. This is Terry. Terry worked at a big corporation for 17 years and was laid off 2 years ago. She has been struggling to find stable employment ever since. Just like Terry, 25% of those we interviewed were unemployed. And of all those who were unemployed, 96% were not receiving unemployment benefits. This is Linda. Linda works at Piney Woods Nursing Home. She's a certified nurse's assistant. Unfortunately, just like her mother and grandmother, Linda has type 2 diabetes and heart disease. Although Linda has been working as a CNA for 22 years, just like 39% of those we interviewed, she does not have health care coverage. This is Susan. She has 3 children, an infant and 2 toddlers. She recently left an abusive husband and is unemployed and living in a shelter. Just like Susan, 18% of those we interviewed were experiencing homelessness. This is John. He's 20 years old, single, and is working as a cook at a nice restaurant on the other end of town. He was driving an old car with lots of miles on it. It cost him more than it should have, but he didn't have any other transportation options. The car broke down, he lost his job, and the car was repossessed. Now he's without a car, just like 31% of the people we interviewed. The problems facing our community can be overwhelming. In fact, 12% of those interviewed were experiencing all the barriers combined: no high school, unemployed, no healthcare coverage, homeless, and without transportation. Overall, the top 5 needs are dental care, eye and vision care, achieving a living wage of income, health insurance coverage, and computer skills. When organizations attempt to tackle these problems individually, success stories are all too rare. However, when we're working together under the right conditions, what we need to do comes into focus. Agree to a common goal. Agree to track progress in the same way, which allows for continuous improvement. Do what each does best, while identifying new ways to work together. Have consistent communication. And finally, have skilled and dedicated resources to support ongoing efforts. This framework is called Collective Impact. Join us. Together we can help make Smith County a bright community for everyone.